Welcome to the Sex4Life podcast. In this episode, Sequoia speaks to Dr. Carolyn DeLucia, a leader in the field of sexual health and sexual wellness treatments. Here's a quick preview of their conversation.
The big mystery, is there or isn't there a G-spot, and how do you find it? Stress. It's not to be a stressful situation. The G-spot is an area on the front wall of the vagina. If you're looking at the urethra where the urine comes out, right behind it on the front wall of the vagina is our G-spot area zone. It's not just one little tiny dot.
I always teach that it's about 20 to 30 minutes of stimulation for a woman's erectile tissue to engorge. What is your estimation?
I think it varies.
Yeah.
I think it varies, but it's definitely foreplay and stimulation prior to penetration is critical. So we all know that men have a penis, it must engorge in order to get erect. And if they don't have adequate blood flow, they won't have erections. That stands true for women as well. Correct.
Whereas if you've got a flaccid vulva, the lubrication isn't there, as you so beautifully described. The lubrication isn't there. The pleasure isn't going to be there. It's going to feel like a hairbrush scratching in and out. And women, I think this is probably going to be maybe a little controversial to say, but women are going to want to have sex less. If it doesn't feel good to her and you're wondering why your wife doesn't want to have sex with you, it's because you're entering the vulva much too soon. I'm so excited today to interview a friend, but also an expert in the field of sexual health, Dr. Carolyn DeLucia. So let me just tell you a little bit about her before the interview starts. Dr. Carolyn DeLucia, a graduate of New York Medical College, is a pioneer at the leading edge of non-invasive sexual wellness treatments. A practitioner of OBGYN for nearly 30 years and alternative therapy expert since 2014, she is sought after by device manufacturers and professional groups alike. Today, Dr. DeLucia is one of the most in-demand specialists in the field. She has trained thousands of practitioners around the world and impacted the lives of countless patients. As the technologies and case studies evolved, so did Dr. Lucia's own private practice. Assembling her experience as a physician and knowledge as an expert in the application of cutting-edge treatments, she developed her own combination of treatments and technologies, which she now offers her New York City and suburban New Jersey patients. She is the author of Amazon bestsellers Ultimate Intimacy, The Revolutionary Science of Female Sexual Health, and Ultimate Connection, The Blueprint to Everlasting Love Inside Yourself. She most recently has contributed to Tony Robbins' latest best-selling book, Life Force. And if you want to learn more about Carolyn DeLucia, MD, please visit her website at drcarolyndelucia.com. And here now is my interview with the amazing, the extraordinary, and gorgeous goddess, Dr. Carolyn DeLucia. Welcome, Carolyn. I am so honored to have you with me today to talk on my new podcast, Sex4Life. As you know, we have talked a little bit about this, but my mission is take the pain and suffering out of relationships and intimacy. And this is one of your areas of expertise. And I am really interested to talk to you in depth about the work that you do in the world as an OBGYN and an alternative specialist in the field of female sexual health and well-being, but also how that relates to relationships. So first of all, can you share with me what it is that people usually come to you for what is the reason, patients usually seek you out?
Well, number one, I want to say thank you for having me. It's always a pleasure for our worlds to interconnect and to unite. So we have a similar mission, and I love to join you in any efforts that you make.
Thank
So
you.
thank you for having
Thank
me.
you. You're absolutely welcome. And I hope to have you on a lot. So absolutely.
Thank you. That being said, my patients come to me mainly for difficulty with being intimate. So that can be painful sex, that can be lack of arousal, that could be inhibitions that they're having to have sex because of urinary issues like urinary incontinence. And these types of conditions can make patients, men and women, very inhibited about being intimate for fear of leaking or having an accident at a very inopportune moment. So those are the general reasons that patients come to see me.
So are you also seeing men, or is your private practice all women?
I see partners. So if one of my patients has a partner who's having difficulty, as you well know, it takes two to tango, I will take care of the partner's issue. And I always tease that if I take care of the woman and the gentleman, if it's a gentleman as their partner, can't keep up, pun intended, I address those issues as well.
You do. So because we wrote our books around the same time, which is when we
Yes,
began our friendship. My first book is on erectile dysfunction,
yes.
and you've read my book, which is fantastic. Thank you for giving me your
Oh,
feedback. Thank
I
you.
love it.
So the side of erectile dysfunction that I deal with is, really the approach to having intimacy with a partner, male or female, non-binary, and how you can build an intimate connection
Correct.
sexually without the traditional, I'm going to say, pornographic theories of sexuality. And your side of this problem is the medical functionality, which I refer people to that I work with, to doctors like yourself. Unfortunately, I'm on California side and you're in New York side, but what are some things that you see happening with the functionality of women? And then let's talk a little bit about the functionality about men. But what are you addressing? Are you addressing just the cardiovascular problems, the nerve problems, or are you also addressing the nutritional and lifestyle problems?
Basically, all of the above. When we look at intimacy and sexuality, it involves many systems. It definitely involves blood flow. So that's cardiovascular health. It definitely involves our psyche. So where we are mentally. If there's been a trauma in the past, that has got to be appropriately dealt with. I don't personally treat the trauma. I will send them to appropriate therapists to get that treatment, but that must be resolved. And then there are issues, nervous system issues. If there's not enough innervation, if there's been an injury of some sort, we have to use regenerative procedures to regrow the nerve and increase sensation. Sometimes that could be hormonal. Then there's the whole endocrine system. What's happening with the hormones? Is the woman menopausal and has zero testosterone, zero estrogen, zero progesterone? All the three wonderful hormones that our ovaries normally produce. And if that's the case, how do we replace that safely and still maintain their overall well-being?
So what you were just talking about in regards to every one of those mechanisms, were you mainly thinking about the feminine aspect or the masculine aspect as you were just describing? Because I think that a lot of people, mainly men, are going to be like, whoa, women need like cardiovascular? What's that all about? There's nothing going on. As you know, I know that the female genitalia engorges, and it's supposed to engorge people. It's supposed to engorge. And there's ways to
Same
get that, which
exact
is
anatomy.
right? But most people just think it's an orifice, right? But let's talk a little bit about female cardiovascular aspects of the pleasure of sex and lifelong sex.
All right. Well, there are many aspects why blood flow to the area is critical in a woman. So we all know that men have a penis, it must engorge in order to get erect. And if they don't have adequate blood flow, they won't have erections. That stands true for women as well. If women cannot have erections, we have erections. We have the same exact tissue. Our clitoris, however, is much more than the little pink tip that we see. There's a whole horseshoe of tissue that continues. And that horseshoe of tissue that is analogous to the corpus cavernosus of the penis that engorges in women as well when we are appropriately aroused. And if we have healthy blood flow to the area. So everything that involves increase and improvement in blood flow will improve a woman's ability to have sensation and pleasure during sex. When it comes to vaginal lubrication, the orifice that we so discussed, that is, of course, very critical to our sexual function. And the full length of the vagina must be appropriately vascularly supplied. If there's no blood flow, there is no lubrication. And that's when a woman will feel dry. And that is not because the gentleman is not appropriately arousing her or her female partner is not appropriately arousing her. It may just not be there. And when there's no blood flow, then there's no lubrication. And the blood flow is supported by our endocrine system, namely estrogen primarily. And our estrogen supports the blood vessels that give the blood flow to the full length of the vagina. When that estrogen is gone, so is the blood flow. And that's when sex begins to feel like the round hairbrush we blow our hair dry with instead of anatomy. So it's critical to maintain blood flow, not only for lubrication, but also for sensation and to engorge the full length of the clitoris.
Okay, so this here is actually what Carolyn was discussing as the clitoris. So this is a 3D model of the clitoris. Most of the time, what we see is just a hood covering the tip of the clitoris. But the clitoris actually has this entire structure. So Carolyn, while I hold it up, would you like to describe what it is we're looking at?
With all the pleasure in the world.
Yay, good.
So the only purpose of that organ is for pleasure, whereas the penis has three functions. It is for urination, it's for sexual function, and it's for ejaculation. So when it comes to the clitoris, we have pleasure involved, and we also ejaculate. That's the beauty of knowledge of your own body. So the clitoris has the crura. So the crura are the outer portion of the clitoris, and it has two vestibular bulbs, which are the inner areas. All of those portions of our clitoris are erectile and erogenous zones. That's why if you're stroking in between the labia and inside the vagina on the walls, you will stimulate and arouse a woman. There, it's hidden right in there, just like that. And the average clitoris will be around 3 to 6 inches. And that's the crura on the sides. Exactly. So this is all areas and erogenous zones that really can be incorporated in sexual arousal in a woman, and should be.
And I think something that most people, I would say probably over 60% of people don't realize, maybe even more, is
Mhm.
these vestibular bulbs, when they engorge, they poof up the center area so that the introitus is actually tighter and smaller to get through. And therefore, when you've got an engorged vulva, all the parts of the vulva, then the pleasure is greater for both partners.
Correct.
Whereas if you've got a flaccid vulva, the lubrication isn't there, as you so beautifully described. The lubrication isn't there. The pleasure isn't going to be there. It's going to feel like a hairbrush scratching in and out. And women, I think this is probably going to be maybe a little controversial to say, but women are going to want to have sex less. If it
Yeah.
doesn't feel good to her and you're wondering why your wife doesn't want to have sex with you, it's because you're entering the vulva much too soon. I always teach that it's about 20 to 30 minutes of stimulation for a woman's erectile tissue to engorge. What is your estimation?
I think it varies.
Yeah.
But it's definitely foreplay
Yeah.
and stimulation prior to penetration is critical. And that's getting to know your partner. I think it's really fun to spend the time to find the appropriate erogenous zones person, and that's not just the vulva. So the
Thank you.
stimulation of the vulva, what we're talking about, that engorgement, does not have to mean direct genital stimulation.
Or even entering.
Or entry.
Yeah.
It's starting here. Let's
Yes.
start caressing the neck, all of the erogenous zones. How about playing with fingers, the palm of the hand? There's so many areas that can sexually stimulate you when you're with a partner, and that's your mindset. Normally rubbing your hands, not sexual, but in an intimate relationship, when you're ready for that connection, it can be very erogenous.
I'm
So
so glad you said that. I'm so glad you said that, because I think that's one of the things, as I was saying before, about the sex education the world has gotten
right,
from pornography is misleading.
yeah,
And that's really at the heart of my book, is like, people, erectile dysfunction, male or female, is a misunderstanding of what sex is.
that's
And you're calling it erogenous zones. I say, the entire body, mind, and spirit is a sexual
yeah,
apparatus, is sexual partnership.
it is. Yeah.
So, what do you think about engorgement coming from the vagus nerve and other areas? Like, you even talked about along the sides of your neck, which I
Right.
will, say is vagus nerve stimulation, the ears and the neck, and also
Uh-huh.
the nipples. What do you think is high up there? Like, if we had a rating scale, I know it's different for every person, but what is the high rating scale of arousal other than the vulva?
Oh my goodness. Well, there's such things as nipple orgasms, where
I'm so glad you said
touch
that.
the genitalia at all. And they're absolutely remarkable. And it's just a matter of understanding what works for you and what doesn't. And that even goes, I will bring up the G-spot, the big mystery. Is there or isn't there a G-spot? And how do you find it? Stress. It's not to be a stressful situation. The G-spot is an area on the front wall of the vagina. If you're looking at the urethra where the urine comes out, right behind it on the front wall of the vagina is our G-spot area zone. It's
Right.
not just one little tiny dot. It's an area of increased sensitivity. And this level of sensitivity varies per person and whether or not it is a particular erogenous zone for that person. So are nipples your area of erogenous sensitivity, or is it your G-spot? Is it your lips? Is it your ears? Is it your neck? Is it whatever is the most sensitive? And they can be all involved. So in really good intimacy where you're willing to explore your partner without inhibition and with the sole purpose of giving pleasure to the other person, there's nothing more wonderful.
Yeah, I just love that the first one that I said in the hierarchy, you mentioned nipples, because that's one that I have found can throw me into an orgasm if I call it the 3 points of contact. If you're
Yeah.
stimulating somewhere on the vulva and somewhere on the vagus nerve, which the vagus nerve goes through the nipple area, the or even the neck, or kissing, I find that it can flip someone into a bigger level of orgasmic
Without a
engorgement even,
without
and
a doubt.
and also ejaculation for a female. That was surprising for me when it first started happening, to have female ejaculation, especially around the nipple area. You and I both have children. So, one of the things about female ejaculation that I try to help people understand the sensation of was when I was nursing my daughter, the breast would just spontaneously start ejaculating milk like and like shooting her in the face. And that's actually the same sensation that I feel when my urethral sponge is ejaculating the fluid that in tantra we call amrita, but is known as female ejaculate. And the nipple stimulation is really important for that. So I'm super stoked that we are having the same hierarchy. Okay, so let's talk a little bit about some of the treatments that you're doing to
Mhm.
help women who aren't experiencing what you and I clearly have a knowingness and an experience of in our own bodies, right? But as a doctor of obstetrician, tell
Mhm.
me a little bit about the alternative practices to heal women of any number of things. Like, pick one of the things that are
I'm going
challenging.
to talk about the most regenerative,
Okay,
which
great.
is a way of healing yourself.
Oh, I
And
love it.
yes, and that's called platelet-rich plasma. So platelet-rich plasma is the portion of our own blood that helps us heal ourselves. When we are little kids and we scrape our knee, yellow fluid comes out, a scab forms, the scab falls off, there's nice new pink skin, and there are no scars. We can look down on our knees. We don't have scars for the most part. And the reason for that is that our platelet-rich plasma has created that new tissue for us, leaving no scar. And the doctors were trying to help athletes get back on the field where the money is. And they realized that scrapes and bruises were healing a lot quicker than the inner portion of a joint. And if you've ever seen those pictures of the inside of a joint, they're very white and clear. There's not a lot of blood supply, which is why a joint has such a hard time healing compared to our skin that's rich in blood flow. So what they discovered is analyzing that yellow fluid, not only does it contain platelets that we know stop bleeding, but our platelets also burst open in an area of inflammation or injury and will call our natural stem cells to that area to build new tissue. That being said, when we draw your blood like you're having a blood test and we process it to isolate and concentrate that portion of your blood, we can inject it wherever we need it to produce new tissue. It will produce blood flow. It will produce soft tissue. It will produce fat if that's what's needed in that area, nerve, any type of tissue needed. So speaking of sensitivity, let's say a woman has lost her sensitivity in her nipples because of surgery, because of a breast lift, or because of breast cancer, God forbid. How can we increase that sensation again? If we inject PRP just below the area, it will build new nerve and better sensation. That being said, if a gentleman is having less sensation and inability to have erectile function, platelet-rich plasma injected into the penis painlessly. We have techniques of numbing. Don't panic, anyone. And it's painless. And it will increase the blood flow to the clitoris when used with a penile pump and maybe something like Cialis or Viagra. There can be a rehabilitation from prostate cancer. I had a gentleman who I brought back to function who was 2 years post prostatectomy who could not have an erection at all. And by using PRP, he returned to function. And that's life-changing, clearly.
It's life-changing. That is amazing. I really love how you explain that, because I know about PRP and I think it's a miracle procedure, really. But I love how you described it and want more people to find out more about it, especially since erectile dysfunction, feminine or masculine versions of it, are really challenging to come back from, because the psychological impact of my body doesn't do what it's supposed to do anymore can be a life trauma that is very hard for people to find their way through. And this is one of the other main topics of my book, because I've had my body not function properly. I've had erectile dysfunction myself and fertility dysfunction, and it was heartbreaking. But to come through the other side and to regrow my body's functionality completely changed my world, my life. But look, what I think is interesting about what you said, and I want to point to, because I want to get a little controversial here, is you said we've got painkillers, guys. Don't worry about it. We've got a whole way of making sure that the procedure of injecting into your penis is not going to hurt, and that's mainly the consideration and the concern for men. But the women's injection are just as painful, and we don't hear women complaining about that as much, right? So, I'm a little bit frustrated about the fact that there is more concern for the men's experience of sexual functionality, and there was more science that has been done over the decades of science for men versus for women. So let's talk a little bit about this. You are a pioneer in feminine or female sexual function, new treatments, right? Why is it taking so long for us women to get help? I mean, I know our genitals are kind of like hidden inside and everything, but come on, why aren't there more doctors like you?
Well, that part I don't know, but It's a matter of, gives me a mission. I've been battling this. There's a huge gender gap. So that's the way we refer to the issues that surround female function and different medical issues that women experience that's truly gender specific that have not been addressed. There's a gender gap in medicine. Women have culturally, almost worldwide, not been viewed as significant or relevant to a sexual response or an event. So the fact that a gentleman can't be intimate unless he has an erection, yet a woman still has an opening, therefore she can still have sex, whether it hurts, whether it's desired, is the problem. It's viewed as a situation where, well, she can still have sex, so what if she's not enjoying it? It does matter that we enjoy it and that it's a pleasurable experience. Like you mentioned earlier, if it's not something that we're enjoying, we may not want to do it as often as you might want to engage in that activity. So when it comes to medications, for example, on the market, there are over 20 for male sexual function, and there are 2 on the market for women. One of them is for women called the little pink pill. It's Addy, ADDY, and it is for our brain. Flubanserin, the actual active ingredient in it, works on the brain in increasing desire. Yet its major side effect is severe hypotension, so a drop in blood pressure. When combined with alcohol, the combination of the precipitous drop in blood pressure and the alcohol, the side effect could be death. There were actual deaths reported. So that's just one of the only medications. The other is an injectable, and its side effect, again, has to be injected within 4 hours of desiring to have sex. And its side effect is nausea and vomiting. It must be prescribed with medication to make you not throw up. And I don't know, but I don't feel too sexy when I'm nauseous. I think it's one of the most horrible sensations, and I'm not thinking about having sex at that moment.
Who are the people who are designing this? I mean, are they men who have no idea what it takes? I mean, we're not just laying on our back. Like sometimes we're being asked to bend our body in half with our legs, over our heads. If you're also nauseous or fearful that you're going to have, any kind of bowel movement, I mean, let alone leaking. I mean, one of the first things that you talked about was, women don't want to have sex when they think that they're leaking, or, feeling like throughout the day you're leaking. It's just not fun to feel like that. I mean, I've had incontinence after a car accident that put my bladder into spasm. Like I know what it feels like. It is uncomfortable to walk around during the day and feel like you can't hiccup or sneeze or cough, right? It's frustrating to feel like your body is failing you in any aspect, right? So let me ask another question in regards to this, because I oftentimes find that people who are taking a medication for sexual functionality are generally hiding it, or because they're embarrassed that they have to take something. And then if sex doesn't happen, they're frustrated that they wasted either the financial expense of the pill, or their body is reacting like it needs to have sex. And if the partnership kind of has an upset and they're arguing and they're not having sex, then there's an either bigger level of frustration. Do you know what I'm saying?
Absolutely.
So let's talk a little bit about that. is it really effective to take a pill for men or for women to have sexuality?
I think it's a huge problem. And I think that what you're really describing is a lack of spontaneity.
Yes.
And the lack of spontaneity ruins the moment. And if you have, that's even with applying a condom, it's a interruption of the moment. Thank heavens, putting on a condom can be really quick, but with even that is a lack of spontaneity and changes the sensation in the moment. So is it so much better to find a method that will increase the blood flow and increase desire without any form of medication or prescription? The answer is yes. And are there ways? Yes. The PRP is just one of them. Another is low intensity extracorporeal shockwave therapy.
Yep.
This is an amazing procedure, completely external for both men and women, and increases blood flow at a depth of about 6 to 7 inches into the pelvic area and bringing it into the genitalia. And they're painless, very quick, 12 to 15-minute treatments. You require 6 of them to grow that blood supply, and the time, it lasts about a year for men and women, and the results are just fantastic. Gentlemen,
do
go
those,
ahead.
sorry to interrupt, but do those actually tighten up, like with collagen, the tissue, and help the nerves to regrow and the vascular system? Is it doing all of those things, or is it mainly just the vascular system?
For the low intensity extracorporeal shockwave, what we understand at this point is that it is blood supply that's
Blood
being
supply.
increased.
Okay.
However, that if there's increased blood supply, that supports the tissue overall. And with improved blood supply, typically neocollagenesis, or the building of new collagen and new nerve, also can follow. Do I have clinical proof of that yet? No, I do not.
Got it. So can it help with incontinence in women?
Yes.
Okay, so
is
because
helping.
incontinence sometimes is just that the urethral opening is just failing sometimes, and that the muscular structure around that sphincter is actually failing, right?
Right. Right.
Okay.
So the basically the soft tissue around the urethra that's considered in a female our sphincter
Mhm.
is weakened, especially either from childbirth and or from the lack of estrogen. Once
Yeah.
again,
Ah.
the estrogen supports that tissue. When there's lack of estrogen, there's lack of support in that area.
Yeah.
With a increase in the blood flow, that tissue is supported and continence is returned.
Okay, so this procedure is with a specific device, but I'm guessing that there's multiple devices on the market now that I know from your bio you have helped to
Yeah.
to innovate, right? So do you recommend a specific kind of device? I know you've been
I
describing it
do.
as
Well,
sound waves, but I know there's
yeah,
one on the market because
it's
I
called Duo. Duo
Duo. Okay.
is the one that I have used specifically and brought to the United States for the function in women, and it's phenomenal. There are other brands that make similar devices. The difference is the depth of penetration.
Got it.
None of them are penetrating to the depth of 13 centimeters. The
Okay.
other devices, the best alternative on the market is 3.5 centimeters versus 13. It's quite a difference.
Okay, so where would people find practitioners if they're not in the New York or New Jersey area where you are? And
If
For all the
Yes.
people who are in that area, please contact Dr. DeLucia's office. You can find her contact information in the description below. But are there other practitioners that people can
Of
find?
course. Yes, and if the best way to find someone who has a duo device is to go on the manufacturer's website called Alma, A-L-M-A.
Okay.
And Alma Lasers will be able to provide a provider locator.
Great. So the Alma website, and we will
Yes.
make sure to put the website in the description so people can find a provider, because I think you're absolutely right, especially for female functionality, sexual functionality, to get even deeper into the source is super important. So talk a little bit about how this device, this sound wave device, works for men, and can a man who has had prostate cancer and a prostate removal use it? Because I do have a lot of clients who have had prostate cancer, removed their prostate, and they're going through a variety of treatments that they can't use any kind of hormonal replacement because of the testosterone growing the cancer some more. So talk a little bit about that.
Well, in situations where the prostate has been either irradiated and or removed, one of the major issues these gentlemen have is actually urinary incontinence.
Mm-hmm.
And it's a big taboo to discuss and realize. It's also very difficult for them to maintain erection because very often nerves will be cut during the procedure. So what can they do? I know of two devices that are phenomenal for the treatment of male urinary incontinence and blood flow to the area. The first one is this device Duo, and it's again external. So let's say this is a penis. There's the groin blood vessels. So the device is actually held on either side of the groin and basically the pubic bone. So just below there, and it's going to generate the blood supply towards the penis. It's often used on the shaft as well. It can also go in an area called the taint, or that spot in between the testicles and the anus. Taint the front, taint the back.
Yes, that's a very important area. I think that a lot of people don't realize how important it is, and I'll bring out my little demo, but this area can be very pleasurable. The taint area is very pleasurable for a man to be massaged, but also it's the hind part of the penis that basically before it goes into the pelvis around where the prostate is. Now, a lot of men who have prostate removal also can have challenges with the functionality of their anal sphincter because like with radiation, right? So can this device also heal this area as well and help to regrow
increase the blood flow?
Yeah.
In order to improve the muscle tone.
Yes.
That's where the other device comes into play.
Oh, okay, good. Tell us about this other
device. Perfect segue. Thank you.
Awesome. You're welcome.
We work so well together.
We do. We got to do this more often.
So the chair, or M-Cella, is a device that is, you simply sit on it. And that technology is high intensity focused electromagnetic energy. And for the men who love Tesla, it's a 2 Tesla magnet. It's a magnet that causes the entire pelvic floor to contract super maximally. What that means is it's stronger than you could ever try to Kegel on your own or tighten those muscles in the pelvic floor.
Yeah.
So the Emsella will make every single muscle fiber in the pelvic floor contract simultaneously
Wow.
11,200 times in 28 minutes.
Wow.
Retrain and rebuild muscle. The beauty of these devices, and I say devices because they started with the chair, and then logically they said, wait a minute, if this is building the pelvic floor, which I refer to as the cradle of civilization, it's where it all begins, right?
Yes.
So the pelvic floor can be built up. What other muscles do people want? Well, logically, abdominal muscles, arm muscles. These are M-sculpt muscles. So M-sculpt is a extrapolation of Emsella. It is basically an extra hand piece now added to the device that can stimulate the abdominal muscles, the gluteal muscles, and the leg muscles, and the thigh muscles, the arms. Everywhere we have muscle that is not directly over the heart. So it does not used on the chest. But any other area of the body, you can super maximally engage the muscle. It builds the muscle and destroys the fat overlying that muscle. And the beauty is that it doesn't only increase the size of the muscle fiber like we get with exercise, but also the number of muscle fiber. And we know this because we have done animal and human studies with biopsies. And that's remarkable. So the efficacy of these devices is truly proven in clinical trials, and the results are astonishing. So for the pelvic floor, for the anal area, for continence, it's amazing. The effects are at least 75% resolution of urinary incontinence in men and women.
So really, when you were talking about the chair, it can help both women as well as men. So you might use that with women who are experiencing incontinence,
Exactly.
or even, after maybe a very challenging labor, to help to bring that pelvic floor that you so beautifully described, seat of civilization, to bring it back to its health, its
Correct.
healthy state.
That's correct. So it's a completely non-invasive way of rebuilding the muscle. It's the only non-invasive device FDA approved for specifically the treatment of urinary incontinence in men and women in the country.
That's great. So how many of these procedures are covered by the I guess the modern day insurance company, or is this all out of pocket? Yeah.
All out of pocket.
Yeah. So how do you feel about that as far as
It's a huge frustration.
Yeah.
Huge frustration. The goal is to get these treatments mainstream, available for everyone.
Yeah.
Not just people that have expendable income.
Yeah.
That's the true snafu. The only beauty of Emsella, the chair, is that it does not require a provider's time. So it's just a matter of purchasing the device, and then it's turned on and the provider leaves.
Yeah.
So it doesn't involve somebody else's time that has to be paid for, whether it's a technician or whoever would perform the treatment.
Yeah.
So that being said, it is less expensive than some of the other devices or treatments that I have discussed. Because those other devices and treatments require either a physician or a provider to actually perform them.
Yeah. Okay, well, let's then segue into this other topic that I think you and I both agree on, and that is that when people are ill, when there is some injury or illness or, functionality problem of the body, from whatever reason, lifestyle choices, or, you and I were sharing a couple of weeks ago that we've both had injuries. I just had an injury to my rib cage because I was surfing with my daughter and I fell on my fist and I ruptured the tissue between the cartilage and the rib cage. It's taken me a month to recover from that. And you really find out when you're in so much pain, it's really hard to have pleasure, right? And when, a partner is trying to lay on top of you and your rib cage is injured, I literally haven't been able to have sex for a month, which as a sexual coach and teacher of it, I pride myself on practicing the techniques on a regular basis to keep my knowledge of the skills up to date. So I know firsthand that when a person is injured, it affects your sex life. And when your sex life is affected, your relationship is affected. And, you unfortunately had an injury recently as well. Can we talk about the medical industry not understanding that these procedures that you're providing and the need to really address injuries so that you can have a good relationship, because we all are relationship beings and we need to be able to function in all aspects of intimacy in order for our relationship to function. And I have a feeling your second book on how to love yourself is a big part of this. So tell me a little bit about your ideas on body function from either an injury, not, we've talked about the sexual function, but how important is it to relationships to have a healthy body, and what choices would you recommend to make that so?
I think that there are there's nothing more important than feeling whole as a person. And when you are accustomed to being active and in every aspect of life, and it's cut short by an injury, there are a lot of psychological issues that come into play. Exercise, as an example, is a great release of endorphins. We thrive on endorphins, which is the chemical of well-being that bathes our brain and makes us feel great. And that's what's released for sexual pleasure as well. When you have an orgasm, that's an endorphin rush. And when you finish a good run. So when you are impacted with an injury that completely stops your ability to perform these activities you're used to, there's a withdrawal syndrome that psychologically has a huge impact on your overall psychological well-being. And then to eliminate your ability to be intimate and to think that that's not important or even be addressed. Well, you can't do that for 6 to 8 weeks. 6 to 8 weeks. I mean, if you don't have a baby in your arms, there's really no other time that that not having sex for 6 to 8 weeks is welcome. There's just no other time in life where that, and it can impact a relationship so drastically when you're not able to engage in that relationship. In that regard, you and I can certainly encourage people to be creative in those needs for sexual release, and the basically different positions, different activities, not necessarily traditional penetrating intercourse would, or even missionary would be recommended. And you've got to figure that out as a couple, if it's possible at all. So,
Yeah, I totally agree. I totally agree. I mean, when a couple comes to me because the husband has erectile dysfunction and they basically come to me to see, can I help his functionality, return? And the surprising thing is I'm really teaching them about the intimacy that isn't taught in conventional sex ed
right.
and pornographic education, which that's a whole nother topic, and very sad that most people are getting educated about sexuality these days from porn, which is not real sex. It's entertainment, people, and it's not really what goes on, and it's all smoke and mirrors. So setting that aside, I think that one of the main problems that I see in our societies around the world, because I work with people around the world as well, is that sex education is really reproductive education.
Oh,
And it,
yeah.
and reproductive education, a woman just has to be a hole and a man just has to have a hard, penis to make that work. And then if it doesn't work, then is there something wrong with the sperm or is there something wrong with the egg? But it's still a reproductive education of sex. Intimacy and sexuality is so much more. And I think we have a challenge around the world to teach people that sexual expression includes the entire body, not just, the psyche is a major part of it, right? Whether you're in it with your psychological functionality or not. But then the taboos around some of the other practices, like oral sex, like for a man to use your hand or to use a toy with your partner, if your penis is not functioning the way you want it, you can still have an orgasm with a what I call a soft on, a sleeping giant. You can still have an
Uh-huh.
orgasm. And if you already have had your orgasm, men, and you're, like you had a PE experience, like a premature ejaculation, and you weren't ready to finish, and your partner has not had their orgasm, don't roll over and say, oh, well, I'm done, and turn over. There are things you can do with your mouth, your hand, your fingers, a toy. Strap one on, guys. I mean, hey, like if a woman can strap one on, so can you, right? There are so many other things that people can do. And it's not wrong. It's not,
Cop out. Not a
yeah,
cop out.
it's not a cop out. It's nothing to be ashamed of. You're
Right.
still having a sexual experience with your partner, and it can be just as fun, and it can have phases. You can have an experience, and then you can pause and eat a little bit of chocolate and have a little bit of, dinner, and then you can come back to it later on. The phases can add to the experience of an overall evening of pleasure.
Yes.
Kissing, ear nibbling, neck chewing, nipple suckling, men and women. There are a
Yes.
lot of men out there whose
I like it.
nipples are so sensitive, and they're like, "Oh, can you pinch my nipple, please?" And you're like, "Yeah, how hard?" And they're like, "Really hard," because the vagus nerve is a major part of their sensation down in the pelvic bowl and the genitalia too. And that's something that I think I was telling you this back when we were writing our first books. I want to write a book for teens and young adults that is the how to really have sex,
Yeah.
not just how to reproduce and have abstinence, and this is the area that like you have to stay away from because you're going to get pregnant. No, no, no. Let's teach what pleasure really feels like, and
Right.
then people will be more responsible about, no, 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 you don't get to do that to me because that doesn't feel good. Let me show
Right.
you what feels good. but we don't have that yet. And what do you think about that? What would you teach if you were teaching the basics of sexual beginnings?
Yeah, I would definitely focus on what intimacy really means. It's not about or only about penetration, which is what I think every adolescent male thinks has to happen, is penetration and ejaculation. And man, I did it. I had my first sexual experience. That's not what it's all about. And there are so many other ways to be intimate. That's what we would teach, starting from head to toe, to fingertips to toe. So, yeah.
Yeah, no, I love that. I absolutely love that, because I think that when we can really reveal what's behind the mystery, then, and without shame, and that it's a sin or anything like that, but to really embrace the beauty of intimacy, which is what your first book is about, right? Ultimate intimacy, right? I mean, it's so important to not only respect that in another person, but also to know how to hold space for someone's intimacy to be born, to be grown out of. One of the things that I like to tell the men I'm working with, so that they can really understand the women and the women of their lives, is that you wouldn't want your woman to just stick a finger in your butthole without asking. I mean, there's some men who likes anal play, which is great, and anal sex is another aspect that seems taboo, but really, if it's done right, it's just as pleasurable as vaginal sex, or even oral sex of any kind. But always ask permission. That's what I say. Always ask permission. So women, if you think that your man wants to have anal play, with and have the experience of himself, ask permission before you even go near it, right? The sphincters. Men, if you want to enter a woman's vagina, ask permission, even if you are married to this person, or you've had sex 100 times. Ask permission. It just shows that you understand that this is a sacred place that is not yours, that might not want sex right now if she's not feeling well or she's not ready. Even if you've been making out for 20 minutes, ask permission to enter this sacred space. And then if you want something even more exploratory, and I want to know from you, like, how you feel about this also, Carolyn, about talking during intimacy. I find a lot of people make mistakes because they're afraid to say, can I put my finger inside your vulva? I use the word yoni. It's a Sanskrit term, but may I enter you with my finger? If you want to do that, ask a question, right? Why do you feel, Dr. DeLucia, that people have such a hard time to talk during intimacy, or even after intimacy?
It's a trust issue, I think, and it's been made a taboo instead of such a critical connection. When you speak to your partner, it's a sign of sharing and understanding and encouragement. Sometimes, a little encouragement, never, because we're also unsure, is this pleasurable, is it working or is it not working? That's another important aspect of verbalizing your likes and dislikes, and what you would want to try to use as pleasuring your partner. So I think that it's just a matter of being comfortable enough, confident enough to go there. The other is eye contact.
Oh, yeah.
How beautiful is eye contact? So when you are being most intimate with someone and you open your eyes, it raises that level of pleasure and connection to another whole place.
I
And
agree.
I think, right?
I totally agree. For this last month, I wrote a newsletter and gave a Tantra exercise. It's called eye gazing, which is exactly what you're pointing to. And sometimes it's not comfortable to do in the beginning. A lot of people who have had, like I was not able to exercise for an entire month, and I'm an athlete. And I even have little roles starting to show up, and I'm like, am I going to actually be seen as sexy as I was before my injury? So eye gazing can sometimes be uncomfortable because we're afraid of people truly seeing us. But that's what into me I see is intimacy, right? To eye gaze is to be present with another person's soul. It's the seat of the soul of another person. And if you can't look into their eyes, do you really want to have this person inside your body?
Right.
And or, the after effects of sex, which is, bonding, right?
Yes.
If you're not willing to bond with this person, are you really with the right person sexually? And that I think needs to be addressed before the sex act.
Agreed.
Yeah.
Agreed.
So this conversation with you and I'm sure could go on, and I would love to, but I know that you are on your vacation. So thank you for taking this time with me.
My pleasure.
You look so gorgeous with the clouds behind you and the palm trees and the blue sky. It's like, good, I want to be there with you. But this is the Sex4Life podcast. So I'm going to put you on the spot, and I'm going to ask you if you could tell us something important that you hold as one of the ways to have a sex for life lifestyle, meaning having the longevity of your intimacy. What is one major tip that you would give to everyone, male, females, about having longevity in your sex life?
It's empowering your own soul. It's loving yourself. If you don't have that core of confidence and personal respect, it's not going to work ever or anywhere in your life. So my advice is to find that inner soul and pleasure and really know yourself, and then you can be a giver to others.
I love that. I really, really love that. That is a great tip. And that goes right along with the Tantra teachings that I do. That is to have sex. Dr. Ruth used to say is sex in Hebrew means to know. And to know another is what the act of sex is all about, which is one of the reasons why we eye gaze and look into another person's soul. And that's what porn doesn't give you. And so for anyone watching this, I'm so grateful for our audience and those people who are following this conversation. I want you to know that the heart of the sexual act is to know another person so intimately that you've touched their soul and inside their bodies. So with that as that last tip, Dr. DeLucia, I want to thank you for all of us who are watching. Thank you for your work. You always like well me up inside. Thank you for your work. Thank you for healing so many women and the partners that love them. Thank you for being a pioneer in the field. And I want to just say, I hope people will read your books because they're both fantastic books that lay out the ultimate intimacy and the ultimate connection. And if they want to get a hold of you, they can go to your website, which we have in the links below. And as always, you are gorgeous. You're like the empress goddess that is out there healing the rest of the goddesses. So thank you for all of that.
And thank you for
You're
all
welcome.
you do.
You're absolutely welcome. We'll talk soon. Bye-bye. Well, that was my interview with the amazing Dr. Carolyn DeLucia. She blows me away every time I have a conversation with her. She is the epitome of normalizing the conversations around sex. And a lot of times during this conversation, she brought up how important the psychology of your sexuality. And that is exactly what I do in my practice. So if you find that one of the things that is impeding your vitality around sexuality in your life and sex with your partner, please reach out to me. Everyone who watches this podcast gets one free consultation with me. I believe in what I do. It is my passion to normalize the conversations around sexuality and to teach as many people as want to know how to have a sexual life that works for you. So, if you want to get that free consultation, go to the description in the link below and hit the button that says book your free consultation with Sequoia. Now, everyone who does book a consultation with me gets a free gift once they're on that call. So please make sure you subscribe to the channel, hit that little bell, and also share this content with your friends, your families, your colleagues, and let's get the conversation around sex to be normalized, to no longer be taboo. Because let's face it, we all got here from the Sex Act, and if you can bring your life into balance in a healthy way, your sex life can last an entire lifetime. Thank you so much, and we'll see you next time.